Hi, everyone. Sandy Grove, registered nurse here again with Health Tracks at Home. Today, we're going to continue our talk about medication safety. And today, I'm going to address some of the what ifs that cause people to have medication problems and end up back in the hospital. As always, I get my information from reliable sources. Today, that's going to be from my history as a home care nurse. But if you have any questions, things do change from day to day and month to month. Please contact your primary care physician. So, what if? What if I run out of my medicine and cannot take it for a few days due to transportation? Well, the options are that most pharmacies have delivery and they might be able to get it there as soon as possible. Also, they do have drive-by pickup. If you absolutely have no one that can pick up your medications and you're going to be without that for a couple of days, please notify your primary care physician and let them know. There may be another medication that you have on hand that you can take during that time, and only they can give you those instructions. Want to make sure that your symptoms are being controlled and that you don't miss your medicines for a few days. Again, what if I'm sick to my stomach and I can't take my prescribed medications? Very common, we get a little tummy bug, and the first thing to go is taking our meds because we're vomiting and we can't hold anything down, much less our regular medications. So this is a good time to notify your primary care physician that you are vomiting and you're not able to take your meds. What they will do is let you know which ones are vitally important, and that you should try to get those down, and what to do if you vomit it back up, etc. So you want to make sure you're talking to your primary care physician about that. And what if I accidentally skip a medication or all my medications at one time? Take your medicines as soon as you figure it out, you skipped them. So just go in and take your medicines as usual. If you take a medicine more than once a day, do not double up on the next medication. So if that's within an hour of the next one, don't do that. Just take it. The next one is time for the next one. The doctors would not want you to do that. And then notify your doctor that you did skip a dose of your medication. What if I forgot my morning medications that I only take once a day? Take them when you find that you haven't had them. What if I will be away from home and when my medicines are due? Some of us take medications in the afternoon and we go to a medical procedure and we get stuck and we get home, we haven't had our meds all day long. Make sure you take a little Ziploc bag or a pill box and take your medicines with you, and try to remember to take them when you're out and about, just for safety's sake. Another what if my new medication makes me sick to my stomach, or feel strange? I can't tell you how many times I've heard I feel strange, and that's usually the word that's connected with pills. Don't ask me why. So read the side of your medication container. Does it say to take your medicines with food and you took them on an empty stomach? If it does say to take it with food, the most common side effect, not allergy, but side effect of medications is stomach upset, because those medicines really do need to be taken with food. So first of all, if it does say that on the side of your bottle, make sure you take the medicine with food the next time, and then kind of monitor how you're doing. If you do okay with it, then let the doctor know that you're having some GI upset. Maybe they could change the medicine if you're not feeling really well on it. But if taking it with food cures it, then you're going to be fine. Okay, another thing is if you feel dizzy or strange with a blood pressure medication. The most common thing that happens with blood pressure medications is orthostatic hypotension. That's a big long word, and all it means is that your blood pressure from a lying to a sitting to a standing position drops when you stand up, and you feel dizzy and you feel wizzy and you can fall, because it usually doesn't hit you until you've walked away from the bed for a couple of feet. So what's happening in your body is our natural physiology is that when we go from a lying, sitting to a standing position, our blood pressure goes up to accommodate us being up. When we're taking blood pressure medicine, it's telling our brain to lower our blood pressure. So when we stand up, there's this instantaneous, am I going down? Am I going up? Am I going down? Am I going up? So it is a natural reaction to some blood pressure medications. And the way to cure it is to rise slowly. Sit on the edge of the bed, a minute if you can, stand at the side of the bed, before you start walking, and that's going to help it go away. If you continue to have problems with it, then you want to talk to your doctor, because there are other medications that do not cause that so severely. So if you have a blood pressure monitoring machine at home and you're having this dizziness, this kind of problem with changing position, check your blood pressure. If it is really low, which would be less than 100/60, unless the doctor wants your blood pressure there, and that's the perfect blood pressure for you, and it's accompanied with dizziness and weakness, contact your physician immediately, sit down and rest. And remember, many people live with 90/50 blood pressures all the time with no symptoms. So you're going to be okay. You just need to get instructions from your doctor about what to do regarding this medication, and they will probably change you to something else. Another question is, what if my weight goes up 3 pounds in 2 days and I'm short of breath when I walk or when I'm at rest and I'm on diuretics for heart failure? This is a warning signal. This is a problem, and you need to deal with it right away. People living with heart failure need to weigh themselves every single day, same time of the day, same kind of clothes or naked, and keep track on your calendar what's going on with your weight. If you do gain 3 pounds in 2 days, there's no way you can eat that much food for that to happen. That means you're retaining fluid. And you need to call the physician to get instructions about what to do so you stay out of the hospital. Now, to be proactive for all heart patients, I recommend you talk to your cardiologist. Many times what they will do is say, if your weight goes up 3 pounds in 2 days, you take an extra diuretic, and then you call me in a day or two and let me know if your weight has gone back down, if the shortness of breath has gone away. They do this many times. It is a very common practice. I'm a cardiac nurse. I know this is very common. So make sure your doctor is in the middle of all this and knows what is going on. And then just a final tip, when you're calling the doctor's office with any of these problems regarding your medications, remember that you are not talking to a medical professional. You are talking to an assistant. And you want to make sure you get very specific instructions so they know that there's a problem. So the new medication that the doctor gave me is causing me to vomit, and I'm not going to take the medication anymore until I hear from the doctor. Boy, they're going to get them on the phone. Or I am feeling really, really dizzy, and I'm afraid I'm going to fall, and I'm afraid to take this medication anymore. My blood pressure is only da-da-da-da-da. Please let the assistant know. Have them call me today. And if they don't call you back today, then you call them at the end of the day to make sure you get information. The other thing is, remember that most healthcare systems have a nurse call line that you can call at any time of the day or night. And medication-related issues is a really good reason to call that number. They will give you the direction that you need to do regarding your medicine. So at any time you can call them regarding medicine issues. And these are just a few of the common ifs. Believe me, there are many, many, many more, but we want to keep you out of the hospital. So don't ever not take your medicine without talking to your doctor. That's the bottom line. COVID update. There are some new things. It just was announced yesterday that the county has approved that 75 and older with underlying conditions can receive the vaccine. You should be hearing from your primary care physician shortly, or they will instruct you either to come into the office and make an appointment or to go to the mass gatherings that we're having to get your injection. We are getting more vaccine into the city, which is great, into the county. Then the other news is variants. Yes, we do indeed have a new variant in the state of California. Oh, joy, just for us, that they do not know a lot about yet. They don't know if it's like the UK variant. All we know is that it is a mutation like the other ones that we've already seen. I think this is number 4. And this is not uncommon, like I have explained before. When we have a virus, they mutate very quickly and we get new variants. So we should know by next week what this one is doing, but it was a breakout here in California and it is spreading. So we're watching to see what it is. They're the guys that do the things are doing the things. Exercise tip of the day. We talked about going from head to toes. So we did our eyes and our mouth. Today we're going to talk about our neck and our shoulders. A few weeks ago, we talked about neck exercises, and I think we all know how to do those, side to side, ear to ear, front to back, and then around in a circle slowly, not like that. And stop in between each section and gently stretch. Never use your hand on your neck to stretch. Only let your head, the bowling ball, be the stretch factor on the top of your head to do these different. And believe me, as we get older, we lose our range of motion in our neck. So doing these exercises are very valuable for you. One, they help with balance, and two, they help with range of motion. So shoulders are easy. Shrugging up to the ears and down, up the ears and down. And if you sing at all, you know you rotate them in a circle forward and you go backwards and you spread your chest. So this is a really good exercise to do multiple times a day to release the tension across the necks and the shoulders. Next week, we'll talk about our hands and our arms. So, memory preservation tip of the day, believe in yourself and give your brain a good old-fashioned workout. You are not too old to learn new things, no matter what anybody says. So this week, I'm giving you an updated version of last week. Last week, I had you do the animal ABCs. This week, I'm going to have you try and assign a letter to fruit. And believe me, you are going to learn some new things about fruits that are out there that God has created for us. It is definitely more difficult than the ABCs of animals. Nutrition tip of the day, we're going to stay with brain health. So we're going to do a brain boosting diet, which we all know is healthy with omega-3s, which we either get from fish like salmon, tuna, halibut, mackerel, trout, etc., or from non-fish sources such as seaweed, walnuts, ground flax, flaxseed oil, winter squash, kidney, pinto beans, spinach, broccoli, pumpkin seeds, soybeans. Then also we want to use healthy fats like olive oil, nuts, and fish, and we want to limit our calories from saturated fats. Remember to read those labels and eat more fruits and vegetables that you're learning from that list you just did. Doing your brain preservation exercises. Try some of those new fruits and vegetables. Stress reliever tip of the day. This technique has been used by the military for many, many years to help our guys with PTSD. It's called box breathing. It's very simple. If you are feeling stressed, I'm going to add a little bit to it, but you just get comfortable with your feet on the floor and you close your eyes for this one. And in your mind, you're going to draw a box. You're going to go wherever you want to start here, wherever you want to start, and you draw a line and you stop at the corner, and then you go down to the corner and you stop. And you go to this corner and you stop, and you go up to this corner, and you breathe as you're doing that. This helps get your mind off of the stressors and helps bring you present into what you're actually thinking about at this time. I recommend that in each corner or at the end of drawing your square box that you think about some things to be grateful for and take a nice deep breath. So I hope that, as usual, this is helpful to you and you can practice some of these exercises and it keeps you healthy and safe with COVID. Remember to wear your mask, social distance, and wash your hands. As always, I get my information from reliable sources. Today, most of that was me. If you have any questions, please contact your primary care physician. Till next time, may the Lord bless you, keep you safe, keep you in his loving care, and keep you free from COVID. Love you. God bless. Bye-bye.